Well, this space may look like a regular doctor's office, but it's actually part of a research lab at U of I's Beckman Institute. This is where engineers are creating technology to help doctors look at cells in a new way without using a microscope. Okay, so how does this affect you, right? Well, the whole goal is for doctors to eventually use it during cancer surgeries. The system collects an optical biopsy, which is sort of similar to an ultrasound, but using light. Medical experts can see the tissue with it and make sure all tumor cells are then removed.
Unfortunately, for breast cancer, the reoperation rate is often very high, 20 to 30%, depending on the studies. But what this means is that they just don't really know if they got all the cells out. So for the patient, this can really be an incredible savings. They don't necessarily have to come back for a reoperation, so there's less anxiety, less costs associated with that, and ultimately better outcomes that the cancer won't reoccur.
He and his team have been working with Carle Health for about 25 years to develop the imaging system. It's still in an experimental phase, but they're looking to expand and work with the Mayo Clinic next. He hopes it can be used in surgeries within the next 5 years. Now, this technology can be applied to many parts of the body and can pick up information for different diseases, either externally or internally. The lab is also focusing on using this device to help kids. It can pick up signs and symptoms of infections, especially in the ear. One researcher says it helps doctors make the best diagnosis possible.
We can make sure that antibiotics are prescribed appropriately, so care is distributed out appropriately, accurately, and then patients are either referred to surgery or just sent home as quickly as possible. That's really what we're after.
This technology is already being implemented here in Central Illinois. He says OSF primary care offices are using it to help children.